My name is Elizabeth Lehman. I'm a fourth semester nursing student. It is 8:10 in the morning and it's April 25th and I'm doing an NG insertion video. Okay. Hi Mr. Smith, my name is Elizabeth and I'm going to be your nursing student today. How are you doing? Okay, good. Can you start by identifying your name and date of birth? Perfect. And do you have any allergies? Good. So the doctor ordered that we insert your NG tube. So we're gonna go ahead and do that today. Can you tell me, do you have any history of nasal surgery or a deviated septum or anything like that? Okay, good. So to start, I'm gonna put on clean gloves, provide our patient privacy, and raise the bed to working height. I'm gonna have my patient blow his nose first. And I'm going to have him sitting up in high Fowler's position. So in order to determine which nose we're going to put the NG tube in, I'm going to seclude each nose to figure out which one he breathes out of best, as well as look in the nose to see which side looks bigger. And we're going to do the side closest to me. So I'm going to start by laying a towel over his chest. I'm going to go ahead and tear my tape to begin with, and I'll need 4 pieces of tape. And then as well as 1 piece of tape for taping it onto his nose. Okay. I'm going to start by opening my tape and measuring out how far. And in order to measure it, I'm going to measure from the tip of the nose to the tip of the ear, and then from the ear to the xiphoid process. And that's about 45. So we're going to put a piece of tape around that so I know where to stop. Okay. And then I'm going to want to coil it in my hands to make sure it goes down smoother. I'm going to go ahead and put some lubrication. I'm going to lubricate about 2 inches. Like I said, he does not have any allergies. I'm also going to have a cup of water ready for him to drink once he starts. I have already figured out he does have a gag reflex, and for him to in order for him to tell me that I need to stop, he's going to put his hand up. So I'm going to start by inserting. All right, Mr. Smith, I'm going to insert. And he's going to start gagging at this point. And now that he's started gagging, I'm going to take my pen light to see that it's in the back of his throat, and it is. So I'm going to have him take sips of water and swallow, and as he does, I'm going to insert 2 to 4 inches each time he swallows. And at this point, he did not start turning blue, but had he, I would automatically remove it. And had I met resistance, I would also want to have him take a couple more swallows, and if that didn't work, remove it again and re-lubricate. I'm going to go ahead and pre-tape it to him while I check for placement. And in order to check for placement, I'm going to want to remove some of his gastric contents to check for pH. I can also place with x-ray, which is the most important way to check, or the most accurate way to check. And then I can also listen over his stomach, which I'm gonna do now, but I'm gonna first clamp it back. and I'm gonna listen for a swooshing. And you want to listen directly on his skin to make sure you hear it okay. And I hear the swooshing, and his pH was between 1 and 5, so that it is placed correctly. The x-ray also showed that it was in the right spot. So at this point, I will go ahead and connect it to him. And then for this last piece of tape, I'll hook it to his clothes to keep from tugging. And like I said, it was designed, or the order did say to suction, so I would at this point hook it up to suction as well. I would want to go ahead and check again just to make sure that it's not coiled in the back of his throat, which it's not. And then at this point, I would want to document the time and date that I placed it, as well as how far it went in, the type of NG tube that I used, how he handled it, and any complications that he might have had. Thank you.